I'm really intrigued, if you're comfortable, with a show of hands, patients or caregivers where you felt that you'd had, for what I just talked about, kind of a proper dance, a proper shared decision making in your ITP journey. Who's felt they had that? Okay. I'm glad some have put their hands up. Yeah. And I've got to say, I'm actually not surprised that's not everybody, because, well, we wouldn't be having this session if it was a perfect world. Now, I thought I'd have plenty of time, but I can't believe I yabbered on for 30 minutes, so I'm just going to go straight to the next session then, I guess. Yeah? Yeah. So, without further ado, can I invite my beautiful patient, Kate, to come on the stage to join me to share her kind of journey with me. Now, I must say, Kate was telling me how nervous she was, and then she just sort of dropped a truth bomb and goes, oh, yeah, look, last time I did public speaking was when I was in primary school. I'm like, what do you mean you did public speaking? Oh, I won a few awards and prizes. I'm like, you're a pro.
No. I wouldn't go that far.
Anyway, so look, thank you so much for really, hopping on stage.
Thank you for the opportunity. No. Hi, everyone.
Now, I know you've had quite a journey sort of in your ITP, I guess, Kate, and I guess I want to start off by asking, can you tell us, how did it all unfold, sort of how you came to the diagnosis of ITP?
Yeah, definitely. So, December of 2022, I had just turned 18. So right now I'm 20. So, when I just turned 18, I noticed a lot of blood spots all over my legs, which we now know is called petechiae. And I kind of just thought it was a shaving rash, but it was happening for a while. So I just, again, thought it was just a shaving rash. I went to the doctor because I'm like, something doesn't seem right. And I got my blood test. Mind you, I was so freaked out to get a blood test because I have a fear of knees and elbows. So a needle, the thought of a needle going into my elbow area.
Oh, hold on, so you're not scared of a needle?
No, not the needle itself.
You're scared of the knee?
Yeah.
Is that what you just said?
The knee and needle, yeah.
That's a very specific phobia. I love it.
Yes,
okay.
Yeah. So I got my blood test and results came back that my platelets were at 15. I went to my GP and they were like, yeah, that's not really normal. Let's give you a referral to a haematologist. And at the time on the referral, it said, to a haematologist and cancer clinic. So I wasn't given any information as to what low platelets meant, what that could mean for me. So seeing cancer clinic on the referral was very scary. I was like, oh my God, do I have leukemia or what's going on? So went and saw the haematologist at the time, and they were kind of like, oh, ITP could possibly be what's causing this. ITP, I didn't get much more information than that. It was just, it could possibly be ITP. And other than that, she was like, they were like, we need to do some testing or stuff like that. So I guess that's where the journey started of ITP. I didn't even really know what it stood for or what it was. That's just how I found out. That was about January-ish, so maybe a month later, when I found out, I could possibly have an autoimmune disease.
So, Kate, I'm intrigued. So, when your GP first conveyed that sort of platelet count of 15,
yeah.
Do you remember
like the tone, I guess, and how that was conveyed? Like were they shocked? Were they? Did they scare the shite out of you? Did they, were they like, oh, what was there? Like,
no,
what's happening?
not really.
No? Okay.
They were very calm.
Okay.
About it. Like there wasn't much urgency about it. They were like, your platelets are at 15, and kind of like maybe we could do some further investigation as to why that could be. But yeah, at the time, and then they did tell us what the range it should be in, so 150 to 450.
Yeah.
And obviously, my mum was with me at the time, and I was like, oh, like that doesn't sound very good. Like it's not really anywhere close to that range.
Suboptimal.
Suboptimal. Yeah. So
yeah.
So it wasn't made a huge deal at the time. My GP, like I've been with this GP my whole life essentially, so I guess they didn't want to alarm me.
Yeah.
Not sure if they had a detailed experience with ITP either. So yeah, I guess it wasn't made a big deal at that time with the GP. Yeah.
So maybe he was, aware of your psychological, emotional health, which is, I think, really important.
Yeah.
Now, fast forward to that consultation, your first hematologist. How long was that consultation? Because it sounded like you were just kind of told you got ITP.
Yeah.
And that was it.
Yeah.
Okay.
Basically, that was it. Like, I remember going in and at reception, they weighed you, they measured your height. I went in and, it was kind of just like a general conversation of, these are the possibilities. We're going to have to do this kind of testing, bone marrow biopsy, like, all of that kind of thing. And I was, like you said, like with the whole jargon, it was a whole lot of medical jargon that we, like my mum and I, did not understand at all at the time. There was a huge disconnect there. And I guess that really what impacted me personally, mentally, I suppose, as well. Like, being in shock, like the fact that I could have an autoimmune disease. There was talk about, getting my spleen out. I was like, oh my God, like I just got this blood test like a month ago and you're telling me I'm going to have to get my spleen out? Like, that's a huge, like for me, and at that age, I'm like, what do you mean? Like, I just want to go out and live my life.
Yeah.
And I was told, could have my surgery to get spleen out.
Wow.
So, yeah.
And can I ask, did you or Mum Dr. Google?
Yeah, absolutely.
Nice.
That was the first thing we did. As soon as we left that appointment, it was such a shock and such a huge amount of information that wasn't understandable, I suppose, like from a patient point of view. So we walked out like looking for brochures or, again, we're in a cancer clinic, so I'm like, well, what are we looking for? If there was any information on this. But we went straight to Dr. Google after that, and I'm like, like this is a possibility. Yeah.
Did it scare you more or less having Dr. Googled?
I'd have to say more.
Okay.
I'd have to say more because, like there wasn't much information given to me about my symptoms or how it could be ITP, I suppose. So, I would say it was a little bit more scary just knowing like the unknown, was there and like wasn't really sure what the next steps were.
Gotcha.
Yeah.
So tell me what then happened? What were the next steps? And after, you basically being medical jargonized, scared shitless, what was next?
I guess next were just a plethora of like appointments really with this hematologist and, like I said, heaps of talk about all these different treatments and not really getting to the detail of what it was. So, or like how at the time it was serious and how like I was just being spoken at, really. We were being spoken at. And as a patient and not knowing what's going on at that time, I was like, okay, I trust you. Just, you know, you're telling me what to do. I'll go with it because I don't know any different. And yeah, I suppose after that, it was just like treatment after treatment. I was put on steroids straight away at a very high dose. And they did boost my platelets, but we tried to wean off them every time we tried like a new sort of medicine. So yeah, all those medicines, mind you, failed. Yeah, very traumatic, but yeah, the steroids would probably, I'd have to say, hit the hardest, like 100% physically, emotionally, mentally, yeah.
Were you pre-warned about the side effects at all?
Absolutely not. Absolutely not. I was put on it. I'm like, oh, okay, great, medicine. It's going to help boost my platelets. That's amazing. You know, was told, yeah, short-term use, but ended up being on it for 6 months at a really high dose. So, yeah, from there, you know, I gained heaps of weight. I just kept on eating. I had an appetite. Like, my face blew up like a balloon. You know, I really hated it. It was a horrible experience. Yeah, terrible.
Satan's Tic Tacs.
They are. They really are. 100%. They are.
Right. So, 6 months in. You were cushioning away from the steroids. What happened next? Like,
well, while I was on the steroids, I was told that we're going to put you on a drug called Dapsone. And I was told that that would counteract the effects of the steroids. So, yeah, take of that what you will.
Novel is what we would say.
Yeah. So I was on steroids and Dapsone at the same time. Within a month of being on Dapsone, I noticed my urine became really dark. My eyes the whites of my eyes starting turning yellow. My face was turning yellow, all my skin was turning yellow. And I was at my second day of uni. So I had just started uni, and on the second day, I was, the haematologist rang my mum and said, you need to get Katelyn to the hospital straight away. We've seen the liver results, and they were through the roof, indicating that my liver had been damaged. It was pretty much confirmed straight away that the Dapsone had damaged my liver, hence why, you know, jaundice, dark urine. And yeah, so I was admitted to hospital that day and had to be flushed out of the Dapsone. And yeah, so that's the experience with Dapsone.
But did the platelets go up?
The platelets did go up. They did, yes, they did, because I was still on steroids at the time. As well. So, yeah, you know, we always play that little game, what's platelets going to be? What's the number of the platelets? Yes. I'm sure we've played that before. But, yeah, so they were okay at the time. They stopped the Dapsone, flushed it out, and was able to go home a couple of days later. After that treatment, the next form of treatment was IVIG. I went in for that. I was still on steroids, and I went in for IVIG, and during my treatment, I had an allergic reaction. So my chest became tight, like I couldn't breathe. You know, I was shivering, so they gave a huge dose of steroids during it as well to, you know, try and suppress that. But, yeah, everything was fine. I remember that day I was wearing my Rabbitohs jersey because Rabbitohs and Panthers were playing that day. Yeah, so I was repping the Rabbitohs that day, and I was like, yes, I got to go home. I was able to get home in time for the game.
Yep.
Yeah. So that was the most important thing.
Priorities.
Yeah,
very
priorities.
Important.
Exactly. I was able to make it home for the game, guys. So
yeah, sweet.
Anyway, so was able to watch the game, went to sleep as normal. The next day I woke up and I had the most excruciating headache. And then I had my breakfast as normal, took some Panadol, hoping it would go away. And next thing you know, I was on the toilet, I was vomiting, diarrhea, and like continuous vomiting, like everything just came out. And then when there was nothing more, just, more. So yeah, I was rushed to the hospital that day and found out I had a septic meningitis as a result from the IVIG. And yeah, that was that was really traumatic as well. I was wearing sunglasses the whole time because the light sensitivity was really bad as well. But yeah, I was there for a few days after that, and I was really discouraged because I'm like, maybe this is it for me. Maybe my platelets will come back up after this line of treatment. But unfortunately, it didn't work, and there was no way I was going to have IVIG again after that experience.
And again, I want to ask, was there any explanation on the potential side effects of sort of these treatments?
I suppose there was, but not to the extent that it happened. Of course, they give you a consent form to sign and say, this is possible, but you don't really ever expect it to happen to you. But in my case, everything happened to me. So, honestly, I was just like, at this point, like, there's no surprises. Like, if whatever's on that list, it's going to happen to me. Like, I was just like, no expectations. Like, I'm not going to be like, the one that gets through it perfectly fine.
And tell me, if you don't mind asking, at that time,
Yep.
kind of what was your mental health life like at that time? Because you'd been through quite a bit.
Yes.
How were you feeling?
Yeah, mental health. That was a big one for me, especially being in the thick of it. As a newly 18-year-old at the time, all I wanted to do was, as bad as it sounds, go to the club, have a drink, with my friends,
I get it. I'm 46.
Yeah.
Still want to do that. Me and Rob and Phil, we're doing that tonight, for sure. Oh, Danielle, of course, she's the ringleader. God, how could I forget? I'm sorry.
Yeah.
I digress. But no, yes, you want to go hit the clubs.
Yeah, hit the clubs, have a drink. So, and at the time as well, a lot of my friends had the opportunity to go do that, They didn't have an autoimmune disease lingering over their head. They were just freely being able to go and act their age, I suppose. Yeah. And that was really hard for me, sitting on the sidelines watching everyone do what I've been waiting 18 years to do. Okay, I know that sounds bad because I'm not an alcoholic. I'm not an alcoholic, I promise.
Mum and Dad, they're not shaking their heads. No, they're proud of you. That's good. That's awesome.
But yeah, like I was waiting for it, and it just kind of all, like, I'm a very big planner as well, so I had all these expectations, all these plans post school, go on holidays, these kind of things, and that kind of all just came crashing down, I suppose. Just drop of a hat. Yeah.
So, and then we had the fateful meeting. But tell me how you found salvation in ITP Australia. Can we say that? That was what it was.
Absolutely. No, 100%.
Preach. We're all believers here. It's okay. It's okay.
So.
Yeah. Yes, call leader.
So while Dr. Google was very intimidating, it also brought us to ITP Australia in New Zealand. So while we're looking into what ITP is, we're trying to find information. There's not much out there, and we're like, is there anything in Australia? Like, is there an organisation? You see like, Cancer Council. There's heaps of stuff for cancer and all that. But obviously, not knowing at the time it was a rare disease, we found that out quickly by there not being much information out there. So, you know, through Dr. Google, we found ITP Australia. And yeah, we kind of just did our research through your website, I suppose, like, you know, like information through there. And, you know, there was advertisement about a patient meeting that was being held in Liverpool, which is quite close to us. And Mum was just like, you know what, let's just go, let's, you know, have a go, let's see what this could bring. I suppose we're like, we've got no idea, we're like going into this blind, what's the downside of it, let's just go. So we ended up going to that patient meeting. And there is where my life completely changed. That's not even an exaggeration. The work that this organisation has done for me, it has changed the entirety, like the course of my life, 100%. I wouldn't be where I am today without them. But yeah, that day I walked into a room.
And joined the cult.
Yeah.
Sorry. No, and then, yes. I was educated, educated.
And there was Danielle, there was Danny, a few other patients, and Patricia as well. And we were just going around in a circle. I guess that was the point of the meeting, to share our journey thus far. And yeah, it was such a good opportunity to hear other people's perspectives and how other people are being treated. I suppose, you know, how they got to the place they are, if they're, you know, have had a long journey with ITP. At the time, I was only 6 months into my ITP journey. So I was fairly new. So I was really in the thick of it at the time, and, you know, sharing my story, yourself and Danielle and Patricia were all like, you know, this is not normal. This is not how we would go about, you know, an ITP patient, you know. This is not how we would treat our patients. But that's where, again, my life changed. I met Danny, and so gracious to bring me in as a patient. And yeah, like, it's been amazing ever since. Yeah.
I don't think I could ever forget the look on Mum's face in that meeting, hearing the stories of the other patients.
Yep.
And I think me and Danny were looking at each other thinking, this poor girl, like, that experience was red flag.
Yeah, I couldn't even talk. My mum had to do all the talking. I could not talk.
Yeah, it was really shocking for us. And it was, I mean, we were moved by what a terrible kind of experience you've had.
Yeah.
It really was.
Yeah.
I'm getting emotional thinking about this. Shit, stop! I said no crying. Why am I first? It was going to be you. So anyway, I mean, I think we both remember how powerful that was. I think, Danny, and
it was such a powerful experience, so moving. I remember walking out of that door, well, even before that, like, after, you know, we went around in a circle, we kind of had general discussion, and, you know, you guys welcomed us with open arms. Like,
it's a cold.
Yeah, it's definitely. But yeah, like, you know, all the superficial things like getting tattoos, piercings, wasn't allowed to do it. You know, I wasn't allowed to leave the general vicinity of the hospital to do anything really, because I was on like such high alert. I was like a walking hazard to myself. Yeah. But yeah, you know, Danielle was like, you know, go get that tattoo. Like, you know.
See, it wasn't me, Mum. It wasn't me. I mean, I said it just a few weeks ago, but it was Danny, like 2 years ago said that. 2 years ago said that.
Yeah, so, you know, I don't think all doctors, I suppose, think about, your situation and your age demographic. Specifically for me, that was a big thing for me. Having just entered the world of adulthood and not being able to do anything an adult can. I was, very much looking forward to being legal.
I don't want to ask the follow-up to that question about, keep going. La 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 la.
But it was so different for me. And if you put me next to my friends who didn't have who weren't just diagnosed with an autoimmune disease or whatever, it was really hard. But meeting you guys was absolutely like a life-changing moment. Like, my life would be so different had I not gone to that meeting that day. Like, absolutely. Yeah.
Now, I guess we obviously had lots of, I think, consultation. I think we spent I think it was an hour our first consultation, I think, chatting and Now, I want to, I guess, know what was the most reassuring thing that you heard from that first kind of, conversation that we had. So from your perspective, what was sort of what did you find was the most reassuring thing that you heard that was new?
Yeah. Well, I suppose the most reassuring thing was hearing that what I had been through wasn't so normal, I suppose. Just hearing that that's probably not the way you guys would have gone about it. That was really reassuring for us, I suppose, and the whole, holistic approach and looking more to your well-being rather than just the disease itself. That was a huge thing for me, again, being the age that I am. I don't want to talk about the medical stuff all the time. It's really nice to hear, you guys talking my language and making me feel so supported, I suppose. Like, you're not just, talking medical, jargon, like we said. Like, you're talking in a normal human-to-human conversation, regardless of the medical side of it. Yeah.
Clubbing and getting ink. That's
exactly.
Yeah, Dad's going to kill me after this. We don't talk about that all the time.
No.
Just a little bit of the time. I can't believe how quickly actually the session has blown by. Would you be happy if you took some questions from the audience?
Yeah, absolutely.
That's your journey. So I thought we might open up to the floor. So,
Yes, that's a great question. Right now, for ITP, I'm on avatrombopag. So after the IVIG failed, we'd kind of got to the criteria of everything has failed, so we can move to the, TPO, which was eltrombopag at the time. And that worked amazingly for me. It was really great, but at the time, again, there wasn't really, it wasn't said if there was another option past eltrombopag, so I was like, this is the last option for me. I don't know, if this doesn't work, I don't know what's going to happen. I don't know where to next. But thankfully it did. It's kept my levels at a stable level. And it was great, except for the whole dietary restrictions thing, which I was fine dealing with it at the time, but then avatrombopag became available and it just suited my lifestyle a little bit. Yeah, the clubbing part of it. Yeah, it just suited my lifestyle a little bit better. So currently I'm on avatrombopag, and it's working amazingly for me, so.
I just want to say that, we're the parents, Katelyn's proud parents. We are extremely proud of her courage and bravery that she has shown throughout this journey. What courage and bravery that Katelyn has shown made us all stronger. So,
Thanks, Dad. Thank you.
and I also want to say we owe a debt of gratitude to ITP Australia, New Zealand, and of course Danny for letting Katelyn get a tattoo, or saying to Katelyn that she could get a tattoo, even though all this time I've been saying that's not good for you. And then when we meet this doctor, he said, "Hey, go and get a tattoo." And I said, "What is this guy on about? Come on, man. I've been trying to convert Katelyn never to get a tattoo, and this guy says, go and get a tattoo." Anyway, she hasn't got a tattoo yet, so. But look, Katelyn, you're most welcome to go get a tattoo because it's up to you. That's fine.
Thanks, Dad.
But I do want to say we do our debt of gratitude to ITP, Australia and New Zealand, for what they have opened our eyes to and the support that they have provided us. We are absolutely grateful and thankful for that. And Katelyn, we are extremely proud of your courage and bravery.
Thank you.
That's all.
Thanks, Dad. As a fellow young person with ITP, how do you go explaining your ITP and your symptoms to your friends? Do you have like a cheat code? How do they understand it? Do they advocate for you? Do you find it easy to talk to them about it?
That's a good question. Look, if I'm being honest, at the time, it was really hard trying to explain what I was going through, because as with anything, it's hard to understand what someone else is going through without you being in their shoes. So I'm not gonna lie, it was very tough, it was them not understanding. It kind of pushed me back a little bit. I was a bit disheartened by it. I suppose, we're not fully developed, at this stage of life, so the lack of empathy was there, and that was really hard, and I'm not gonna lie, I did lose some people, along the way, but I wouldn't be the person I am today, had I have not gone through this entire experience. So it's definitely hard being in this age bracket with people not understanding what you're going through, but again, it builds resilience, and we wouldn't be who we are today without that. Yeah.
Hello.
Hello.
I'm from Brazil, and I have ITP too.
Yay.
I did the treatment with Dapsone, and I developed Steven Johnson syndrome, one of the worst cases that everybody see. And they test you for metal allergies after what happened with you with the Dapsone, because I discovered years later that my problem was metal allergies.
Oh, wow.
That's what caused the Steven Johnson syndrome with Dapsone, because Dapsone is sulfur.
Yeah, yeah.
It has metal in the formula.
Yeah, wow, that's very interesting. No, there wasn't any further testing after they had deemed it a liver injury. They kind of just said, it's the Dapsone. So that's very interesting, actually, because, there wasn't any further testing after that incident. That's very interesting.
Because I discovered that this was impact everything, like with the jewelry and everything,
Yeah.
I have metal allergy, and if I knew in the time, Dapsone is not one of the treatment that I...
No. I don't, there wasn't any testing for that. I haven't been tested for that.
So just want to make a comment that I think really it sounds like what Kate had was something that's very common with Dapsone therapy, and that induced red cell homolysis. So I think that's what the injury, sort of liver injury was. It was hyperbilirubinemia. So it was the red cells being smashed and broken down, releasing all the bilirubin, and hence I think the levels were extremely high. And of course you can get also abnormal LFTs, but we know when you stop it, it generally goes back to normal. So I suspect that Kate just had really what is the most common. In fact, it predicts platelet response. So when you actually hemolysis, we know, you know what? The patients were developing 20-gram drop in the hemoglobin, which is quite a bit. They're the ones actually will respond to that. So hence I was not surprised that her platelets went up, because, well, she really suffered from that hemolysis. Yeah.
Price, doesn't it?
Yeah.
So being a planner, what's on the plan next? So you've done your drinks, you've done your clubbing, you've got the tattoo, or coming soon, planning, whatever.
Look,
what's next?
Like I said before, my plans literally went down the drain when all of this happened. So my plan was to become a midwife, actually. So I had started uni that year, and I was actually told that I wasn't allowed to have any vaccination or intravenous injection, purely because the risk of bleeding, I suppose. So I needed 3 COVID jabs. I had only had 2 to complete my placement. And yeah, they wouldn't accept me into the program because I didn't have the 3rd COVID jab, which was really, really upsetting. But from that, I now have a full-time job, and my next plan would be to travel, I suppose. Like, I want to go see the world, being told I wasn't able to fly or, go anywhere. My dream is to not be stuck in one place, I suppose. So, travel is a big thing, but the tattoo is definitely on there as well.
Rob's got a good list for you, I'm sure.
Could I just really make a closing comment in that? Thank you so much, Katelyn, for really being so courageous to share your story on stage. And look, to me, when I heard about your story that night, I went back and I told Sarah that night that I was so shaken by what I've heard. In terms of the things you were told, how really essentially your life was basically completely put on hold. Through, really, there's no other way to say it, was misinformation you were given about your disease. And it horrified me that this could still happen in 2023. And I was so upset when I got home. I was telling Sarah about it. I really was very shaken. And to see you now, the thing what's amazing is your strength. I remember thinking throughout, after we did see each other, I thought, geez, you've taken this really bloody well, what you've been through, knowing that that wasn't the way you should have been managed, but then to just carry on and do what you need to do. And you see this beautiful, strong woman I see today who's full of confidence, with your future bright ahead of you. I think your parents should be very proud that this is a pretty amazing young lady here, and I'm very proud to be a hematologist. So, thank you.